Hi everyone, very good evening. I hope I'm audible and visible, and welcome to a quick 1 hour session of the most important PYQs. So all of you are aware of the PYQ challenge which was ongoing on the Prep Ladder app. So what you were supposed to do at your end was cover the entire PYQ Q bank with respect to microbiology and then join in for this session. If you've done that, excellent. And even if you haven't, that should not stop you from attending this session, because this is going to give you an insight of over 1 hour is what I've decided. We will be discussing the most important PYQs which I felt are important as topics, because I have always said this repeatedly: PYQs are overhyped, overrated. No copy paste PYQs are asked in any exam format of our country any longer. But yes, they give us a very good insight into previous year topics. So I've picked up 25 such questions, and now only solving this is not where our work ends. We have to always know and be prepared for what the new pattern can be. So I decided to pick out some topics. For example, Vibrio cholera, anthrax. These are becoming extremely important and favorites with examiners. So I tried to correlate it with lengthier questions, which I try to look into the USMLE Q bank. I try to look into other Q banks, other exams, and I've also picked out some lengthier questions on the same topic from those Q banks. So this session of 25 questions will not just limit you to the NEET PG PYQs. It will also give you an insight into the new pattern. Before the other questions come up to me, I think everyone is going to ask me, when is LRR? I think I've answered it a million times, and I shall do that one more time. LRR always happens in the same month as the exam. So your exam is in August, unless you want it preponed. So since that is in August, the LRR will also be in August. And I've already raised the request to the team that within the coming week, they should give you the schedule so that you can plan your studies. Next, if you want to practice more lengthier questions, we are having Telegram quizzes. You can join me on Telegram and attempt them alternate days. We are having Telegram quizzes of both Path and Micro. And today we have the Micro session. We will have a similar Path PYQ 25 to 30 question session, which will happen on Monday, coming Monday, that is July 20th. That's, I believe, everything that you would want to know. Can FMG students join in? Yes. Just before we start, everyone should be doing the PYQs of every exam. Whether you're a NEET, FMG or INI aspirant, you have to do PYQs of every exam. As long as it has a PYQ tag, it is meant for you. If you still want the PDF of this session, although it's PYQs and I believe you are champs, but I will circulate the PDF on Telegram after the session is done. And I believe that now settles all of your doubts, which now leaves us with 1 hour of these 25 topics which I have handpicked, which we want to discuss. This is not a session which I want you to revise over and over again. I just want you to go through it once with me right now. Maybe keep a PDF in some hidden folder. If you get time later on, you can always revisit it. Otherwise, even if you've done it with me here, and I'm sure you're solving these on a daily basis, this should settle it for you, because the main will always be your video notes which you have done. Along with that, you will be supplementing it with the LRR that we will have towards the end. I think we can get going. The first question that I have picked up is actually from the USMLE Q bank, because I just realized that this question was just like the NEET PG PYQ with a more lengthier body of the question stem that was given. So if we start reading, a 29-year-old primary gravida, 31 weeks of gestation, presents with fever, with muscle aches, nausea and watery diarrhea for 3 days. There is, this is a very typical, whenever they make it lengthy, they try to give you a lot of miscellaneous information, what is happening in the patient's life, in the family life. So all of that info will be given. When attending a family picnic, and there comes a buzzword that there was something regarding meat and cheese, things which are stored in freezers, stored in fridge. And further they say that the growth is occurring at 4 degree, and as soon as this buzzword comes up, excellent. We all know that this is to do with listeria, right? Listeriosis or Listeria monocytogenes. So they've asked you the toxin, or they've asked you what is the virulence factor. Even if you didn't know separately, you know for a fact that, okay, Listeria is the matching word that we have over here. Now, if I look further, these were some buzzwords which I could easily pick up, and that is exactly what you're supposed to do. But this is the buzzword that I expect going forward. And I'll also show you the similarity that this had with the NEET PG PYQ. So anything, I've kept a color coding this time. Any question that looks this color is what I've taken up from the USMLE Q bank, modified it to make it into NEET PG. And anything that comes up with this color is how we used to do it earlier. This is your NEET PG PYQ. So this is very similar to how it came in the exam. If if you can see the same fever myalgias with gram-positive bacilli, growth at 4 degrees, and they asked you the virulence factor. So this NEET PG PYQ had a striking resemblance with the other exam patterns, and over here also the answer is the same. So let's take this moment to quickly revise. We are not focusing on PYQs, we are focusing on topics. So let's discuss everything about listeria. If what is the hemolysis that they told you? They've mentioned it. It is beta hemolysis. What is the food item that they will mention in the exam? Something to do with cheese or refrigerator, because this tends to grow at a 4 degrees centigrade, and after consumption of that the patient is having diarrhea. If you want to do the diagnosis, you are obviously going to do a test which is known as ELISA. If you want to know is it motile, I think they've mentioned it so many times. Yes, it is motile. If it is motile, it must have a flagella, right? Which kind of motility? Tumbling. Tumbling means what? Like a drunk friend falling left and right, that motility. But that motility is differential. By differential I mean that it is going to be motile at a temperature of, let's say, 20s. Anything in the 20s, 22, 25, it will be motile. But if you increase the temperature to 37 degree, it will not be motile. And the way we learnt it was, tumbling means like a drunk friend. So you can afford to get drunk in your 20s, metabolism supports. You cannot afford to get drunk in your 30s because your metabolism and liver both will not support. Finally, coming to history of gravid, like over here you had this gestation history. Yes, mother to child, this kind of history can be given. And is there an animal test? Now this is something which is like a pure ratification thing which they might want to judge you on. So anten test kya hota hai? It is nothing but an animal test which is done for listeria. If you ask me what is going to be the treatment, it is a combination of ampicillin and gentamicin. So your entire screenshot from the rapid revision notes also I have discussed, and that is what you're supposed to do with PYQs. It's not just the question and the answer, because I believe so close to the exam you anyway know the answer. It's about revising the topic so that whatever variation they will give you around that, you will be able to answer it whatsoever. I think yes, most of you are right. This animal test is to do with the rabbit eye. If you inject it, the rabbit ends up getting keratoconjunctivitis. But again, they're not going to ask you the details of an animal test, but definitely the name being fancy can be asked out here. Is that okay with everyone? Because now I'm taking you to the next question. This again, first I will show you how the question came in the USMLE bank, and that doesn't mean that I'm trying to tell you you have to start solving UWorld or first aid or any of that. I'm just making you familiar that you have to stop getting scared. आपका भी topic वही है जो foreign exams का topic है या lengthier topic है. I am trying to show you that there have been copy pastes, and your NEET PG Q bank, if attempted well, is also good enough to prepare for this exam. So here we have an 18-year-old college student. There's shock, there is purpura and meningitis. I think as soon as, make this as a rule, whenever meningitis comes with some kind of a rash, Neisseria meningitidis will always come to my mind, only as a tentative diagnosis. And then they say gram-negative diplococci. Yes, all cocci are gram-positive, but we know Neisseria happens to be gram-negative with meningitis fitting well. But that is not the question over here, because somewhere in a family also something about meningococcal is mentioned. Question kuch aur hai. The question here says that despite appropriate antibiotic therapy, they have said that there is absence of the complement pathway. And now they are saying that their reduced membrane attack complex formation is noticed. So I had got this question as a simple one-liner in NEET PG earlier, that when there is a MAC deficiency, which infection occurs? We used to study M for MAC and M for meningococcal. Now they will go one step ahead and ask you the pathophysiology behind it. That is what is the new pattern. And this is not something which has come for the very first time in your exam. This has been asked. What I did instead was that I made it a little more lengthier, a little more complicated with regard to English language. Otherwise, the concept is the same. So when you are talking about MAC, membrane attack complex, what is it made up of? C5b to C9. That is the deficiency of membrane attack complex that they are saying. So whose membrane does it attack? Tell me normal. Membrane attack complex is going to attack the membrane of a bacteria. That is how it kills a bacteria. So if I'm saying that the membrane attack complex is not there, the bacteria will not be killed, and that is why my patient is having meningitis again and again. So now tell me, is this affecting the opsonization? No. Is this affecting the pathway activation or starting? Again, no. Is this affecting phagocytosis, NADPH oxidase? Again, no. What is it affecting? You were supposed to make pores in the bacteria and you were supposed to kill it. Are you able to do that? The formation of pores on the bacterial membrane, that is what is impaired in this patient, and your answer over here. So now this is just to bring your heart rate back to normal, that what you were reading is MAC leads to meningococcal meningitis was just one liner. What I've given you over here is a 7-8 liner, but the concept ultimately remains the same. And very similar to this has been asked in a little different way when it comes to NEET PG. So NEET PG mein thoda ratification earlier back in the day was more. So this is how the question came. They said 19-year-old college student with headache, neck rigidity, all of these go in favor of meningitis. Meningitis with a petechial rash, did I tell you you have to think of Neisseria meningitis? Now when I see further, they say gram stain shows gram negative diplococci, although the kidney shape that they mentioned that year was a little doubtful, because see, when I say kidney shape, that goes more in favor of gonorrhea, but this is not a history to do with gonorrhea. So that is one more advice that I want to give you with regard to the microbiology questions. And before I solve this, I will tell you what happened in this particular FMG exam. In your notes, you must have studied there is a disease called lymphogranuloma venereum, genital ulcer disease. And we always study that in lymphogranuloma venereum, the genital ulcer is painless, patient does not have any pain, but the lymph node, which is known as buboes, is very, very painful. But now the examiner ended up saying everything is painless. That's what happened in the recent FMG. The ulcer was also painless. The lymph node was also painless. And when everything is painless, our students start thinking of syphilis. That is how you've learnt it. But then after that, they wrote a very characteristic word called the groove sign was positive. So now does syphilis show you groove sign? No. What shows you groove sign? Lymphogranuloma venereum shows us, but ma'am, that was not clinically matching. But then when you have to go for buzzwords, see, whenever you get a contradictory history, to kya karoge? Either you can leave the question or you can take the smartest guess that is in front of you. Whenever I'll see groove sign, I will not think of syphilis, I will think of LGV. So then I will ignore the pain history given, because pain or no pain is a very subjective thing that the patient is telling me. But what I'm seeing with my own eyes, which is the groove sign, that is something that I will mark. Same way over here, it is going very well in favor of meningitis. सब कुछ meningitis के favor में जा रहा है. CSF examination हो रखा है. Bacterial meningitis का पूरा history है. So this one word over here, I take a skip on it. And this happens a lot in microbiology questions. They've asked you the virulence factor. So now the rule is whenever meningitis comes and diplococci come, diplococci means there are two bacteria that are going to be together. So now either it can be a gram positive diplococci or gram negative. Gram positive aaya, so what will you be thinking of? I will think of Streptococcus pneumoniae, because that also causes meningitis. But gram negative aaya, I will think of Neisseria meningitidis, which is the case over here. Now they've asked you what is the virulence factor out of all of these. And I believe everyone has already answered. The answer was very simple, IgA protease. For any kind of Neisseria, Neisseria meningitidis ho ya gonorrhea ho, for any of these, the virulence factor is going to be IgA protease. And now let me tell you the technicality of it. Neisseria meningitidis, but aaya kahan se? It has come from the nasopharynx. So all this nasopharynx, your respiratory mucosa, what is the antibody that is present? It is IgA. IgA is all ready to fight for you. That is a protector in all our mucosas. It's known as the mucosal antibody. So don't you think this bacteria should carry something that breaks this IgA, breaks the first line of defense, and then this bacteria will be able to cause infection in us, and hence one of the most important virulence factors is this. I believe this is settled. तो अगर थोड़ा लेंथियर टेक्निकल क्वेश्चन आया, गोइंग मोर इनटू द लॉजिक पार्ट ऑफ इट, दे विल ट्राई टू टेस्ट यू ऑन MAC deficiency and meningococcal. If they want to go into ratification and ask you the virulence factors, they will ask you to do with this. So you'll see a lot of this happening in today's session, where one question goes more into concepts, one question goes into ratification, but the topic remains the same. Let's pick up the next. I hope you're understanding how it's come up. This is exactly the next thing, and I didn't see much of a difference when I compared the USMLE and NEET PG Q bank here. A 58-year-old man with uncontrolled diabetes mellitus, and whenever this kind of a history comes, and although any immunosuppressive history can come to you, but their favorite history in this situation is always uncontrolled diabetes mellitus, or they will give you an HbA1c which was 9-10% uncontrolled. Now they say there is facial pain and black. Remember that black fungus during COVID, which is nothing to do with black, but only the black nose lesion or the nasal discharge gave it its name. Further, there is periorbital swelling, ophthalmoplegia 2 weeks after recovering from severe COVID. So this person has two reasons for immunity going down. One is diabetes uncontrolled, one is COVID, maybe he got steroids for it. Now then everything related to the, the orbit and the sinuses is mentioned, MRI is done, they go in for histopath. And I think here you get your buzzwords which for microbiology, without which you cannot solve a question of mucor. Mucor is always going to be 90 degrees and is always going to be aseptate. And not to your surprise, the same question has also been asked in NEET PG earlier, and there nothing much. Instead of diabetes, they have given only COVID-19, and they have mentioned that there is aseptate hyphae at 90 degrees, and this is the picture of mucorales that they can give. You can notice over here there is a 90-degree branching occurring. They are all clean. There are no septate, because the opposite of it is what? Opposite of which is aspergillus. Aspergillus में कौन सा branching होता है? 45 degree acute angle branching. And which kind of hyphae are seen? Septate hyphae are seen. So clinically क्या difference होगा? Obviously in case of mucor, I've understood that either it's a diabetes or it's a COVID-19. That's their immunosuppressive favorite history. But when it comes to aspergillus, they love giving history to do with lungs. Now something around the lungs will be there, and again, what are their two favorite lung related history? Ya to they give a history of aspergilloma. What is aspergilloma, guys? Oma means tumor, benign tumor, but this is not a tumor. It basically means that the lung had a cavity from beforehand. Now, I don't know why that cavity was. Either the patient had a cancer, or the patient had bronchiectasis, or in our country, patient had TB. Secondary TB leads to cavitation. Cavity was because of some other reason. Aspergillus has gone and just sat like a lazy person, just gone and sat in that cavity. That is known as aspergilloma. So they will say there is a pre-existing cavity because of a prior TB infection, and now there is a mass that is formed, so you will start thinking of aspergilloma. Second, they could give you something to do with allergy, because aspergillus can also cause that. It is allergic bronchopulmonary aspergillosis. All in all, bronchopulmonary history has to be given. I think we are settled. Now coming to the next aspect of it, which is this 65-year-old diabetic patient with, again, everything of diabetes does not now become mucor, is why I gave you this in continuity. Something of diabetes will always come. We are the diabetic capital of the world. So diabetes to hoga. It's pretty much like HIV and TB, that a balanced paper will always have it. But now just don't go with that notion that every diabetes and I will only think of mucor. It could be anything else. Now along with that, ventilator associated pneumonia might be written as VAP. I think you've already started thinking of at least one bacteria, that is Pseudomonas, and for knowing that I need to pick out that blue-green pigment and the fruity odor. Rest of the information is correct, but is it important for me to focus on every word? I don't think so. Yes, it is gram negative. We know that it does not ferment lactose. Can you tell me the lactose fermenters, if ever given in the exam, will be only two, that is E. coli and Klebsiella. Lactose fermenters will be E. coli and Klebsiella, but everything else is non-lactose fermenter. It has a fruity odor. I think they have also mentioned that it's mechanism of action. We know this. Abhi, I've got you 4 questions today on mechanisms of actions, because every exam you pick up the recent INI or FMG or any paper of late, mechanisms they have suddenly gotten obsessed with, especially the mechanism of anthrax and Vibrio have become for some reason their favorite. So yes, the action is given. They've asked you what is the toxin responsible for it. What is the toxin? I hope you did not just read blue-green hai, to ye mera buzzword hai, to pyocyanin mark kara, because they've not asked you the name of the pigment. They've asked you the name of the toxin for Pseudomonas, and that is going to be exotoxin A. Now similar question has been asked in NEET PG also, where there is a blood culture for some prolonged fever and you have a blue-green pigment with fruity odor, which you had to clearly mark as Pseudomonas. So the difference is that easy question kya hoga? Tell us the name of the bacteria, which has been the case till now. Now going forward, that level 1 question is out. वो तो बहुत rare आएगा. Telling you the name of the bacteria is your job now. You identify the name of the bacteria. They will ask you something about that bacteria, ya to mechanism or the name of the pigment or the name of the toxin like you had over here. So now can you tell me that when I'm talking about the toxin, it is exotoxin A. If I talk about the pigment, blue-green pigment, what is it? It is going to be pyocyanin. Cyanin will tell me blue-green. So every infection of Pseudomonas, like for example, if there is a nail infection, the nail will become green in color. Everything will become green in color. The question that you forget in the exam is Pseudomonas ka selective media, which I think most of you have started writing, and I really appreciate that, which is cetrimide agar. यहाँ पर दो selective medias हैं, which mostly selective medias you remember because we've studied it so many times. Two places where I have seen max errors happening. I'm teaching you those. First, Pseudomonas ka selective media students tend to forget. I hope not from today. Cetrimide agar. Second, for Bacillus anthracis, because in Bacillus anthracis you are so focused on knowing that inverted fir tree appearance, medusa head appearance, वो सब तो याद रह जाता है. What you forget in the exam is the plet agar, which is the selective media for Bacillus anthracis. In दोनों का selective media is little different, off track, so remember this. Let's go forward. Let's compare one more question. I'm not doing all the mechanisms of actions abhi, because as I said, I have 4 questions today, so we will study all the mechanisms of actions. Let's start with the question that we have over here. This is more of a general micro question. Again, this is something I've picked up from the USMLE Bank. Then I will compare it with NEET PG. A pharmaceutical company manufactures an intravenous monoclonal antibody that loses its biological activity above 45 degrees. Something about temperature sensitivity, heat sensitivity is mentioned. Quality control testing confirms the final product has to remain sterile, obviously free of bacteria, and has to retain whatever tertiary protein structure it has. How will you do sterilization over here? So when they've mentioned it cannot go above 45 degrees, I will not go above 45 degrees. Now that is obvious. I will not go to 160 degrees. I will not try to create steam because that is usually 100, 120 degrees. So we don't want to do that. Gamma radiation again doesn't seem right. Gamma radiation can be done. I'm not saying it doesn't seem right, but what they've mentioned is that they also don't want any changes in the tertiary protein product. They don't want any changes with its respect to temperature. तो मुझे दोनों चीजें ध्यान रखनी है. While temperature I'm not applying, gamma radiation, ma'am, you still can apply because it comes under cold radiation. वो आप कर सकते थे. But then when I read the next option, which was filtration, don't you think radiation might still have some impact on the structure? But when it comes to filter, imagine filtering water or filtering air, that does not have any impact on anything, neither the temperature problem nor the structure problem. So the single best answer which I had to select over here would have been membrane filtration, because there is no question of changing anything. It's just passing through a filter. The filter average pore size. NEET PG में क्या question आया? Old PYQ. What is the average pore size when it comes to filtration? It is 0.22 microns. There's a one more NEET PG question that has come, which I've got for you over here. Here they tell you about a microbiome lab, and they say there is some culture media. That culture media has something to do with glucose, proteins, eggs, or some composition will be given. And then they say something that is denatured at high temperature. So what is the most appropriate? So I will not do hot air oven. Hot air oven का temperature क्या होता है? 160 degree for 2 hours. That is high temperature. I will have denaturation, so I don't have to use high temperature. Autoclaving, I'm not even asking you guys. 121 degree, 15 minutes, 15 psi, high temperature again. What is tyndallization? Tyndallization occurs at 100 degree. It's very similar to boiling. Boiling is also at 100 degree. Tyndallization also at 100 degree. The difference क्या है? Boiling, like you boil water, that's a one-time process. Tyndallization is a 3-day process. You are going to do 20 minutes, 20 minutes, 20 minutes every day. So it goes as 120, 120, 100 degree, 20 minute, 100 degree, 20 minute for 3 days. I do not have to apply high temperature. So the single best answer here is also filtration. So now just look at the change in the question that I've got. यहाँ पे भी concept same apply करना था, but when it becomes a tougher question, that question becomes lengthier, number one. It becomes more complex with regard to its language, and then I get also stuck between two options. That's known as making a question tough, and hence I say PYQs are overrated, because ऐसा copy pasted आपको नहीं आएगा. But if you've solved this, you will know how to approach these kind of questions, and the examiner can make English tough. Just keep doing English to whatever language you are comfortable in. Try to always, if you're comfortable with English, excellent. If you're not, if you're comfortable in any other language, उसे translate करो, and that will start making a little more sense. Let's solve the next question that we have. Very different from how it was asked in NEET PG, but we will try and solve it. As I said, the trick over here is if you've studied well, the concept is sorted, knowledge is sorted. Now you just have to take care of how the twists are coming your way. I have a biotechnology company, engineering Escherichia coli, E. coli to produce recombinant insulin. The first line of this question can scare any confident person on this planet. But the point is that you will have to keep the faith and move forward. During large scale fermentation, and how would I have not been, very tensed? Because a quick retrospective tells me that in 2 seconds, I read the 4 options and I understood कि ये तो growth curve का question है. This much I got it. That's all that I had to know. Now my nerves become a little more calm that this is not something big. This is playing with language. They say that further during the fermentation of E. coli, nutrient depletion and because of accumulation of a lot of byproducts, there is a halt in the increase in the viable cell numbers. So now let me just remind myself कि अच्छा what did I study in growth curve? Number one, I had studied that the first phase is known as the lag phase. Y-axis पे क्या दिखता है? Number. तो lag phase में तो number remains the same. After that, the number starts increasing. The bacteria start dividing. Number increases. That is the log phase. And after it increases, there comes a time when everything comes to a stop. That is stationary phase. And maybe that is what they are talking about over here. They are saying that there is a halt. This means initially the number of the bacteria were increasing. Now there is a halt in the viable cell number. Why? Because after dividing, a lot of byproducts will deposit, and that is why the bacteria has now reached its stationary phase. They could have asked me in a simple way that the bacteria was dividing and it has now stopped dividing. So what is the phase that has come? But simple is not what the examiner is wanting to ask you. I'll now show you how the question came in NEET PG, which makes it a lot easier for us. There's a microbiologist inoculates bacteria into any broth. During one of the phases of growth, the number of viable organisms remains constant. This was also not a very straightforward question that came in NEET earlier. The number of viable organisms remains constant because the rate of cell division equals the rate of cell death. मतलब cell divide होता होता that came a time where division and death rates are equal. This means it has come to a standstill, means it has come to a stationary phase. Now tell me your most ratification question, that what are the 4 things that happen in the stationary phase? The way you write stationary, we used to make stat ka stab. So can you tell me, number 1, spore formation occurs in the stationary phase. Toxin production occurs in the stationary phase, antibiotic production occurs in the stationary phase, and bacteriocin production occurs in the stationary phase. So it might sound like stationary phase कि कुछ भी नहीं हो रहा, but I see there are four things being formed, and that is the life advice or the motivation that I can give you right now. You might be at this phase of your GT where you feel कुछ भी नहीं हो रहा, ma'am, my score is not going up, my score is not going down, I'm stuck at that same number since the last 3 GTs. तो आपको ऐसा लग रहा है, but keep going, because what is happening out here is that you are actually gaining a lot of knowledge which is not showing on the numbers but is definitely happening at the back end. So right now, even if you're in a stationary phase, you are producing a lot of things, so stay confident. Let's go forward, and now I've got 5-6 questions which are not exact NEET PG Q Bank PYQs, because I felt कि PYQ तो ये लोग रट चुके हैं ना, that kind of a notion we have. So let's turn around the language a little. Let's give them confidence with some newer questions. So let's make you solve this. Not an easy one again, very, very difficult, but let's solve. A biotechnology company. Today I made a lot of companies, lot of residents, lot of lab techs, so that I could confuse you to the max. They are producing a recombinant protein that selectively enhances the expression of protein kinase R. I would have run off after reading such a question in the exam. It just builds a lot of anxiety for no reason. But what did I tell you? That if you look at the options, you're like, ये तो थोड़ा path, general micro वाला question है. कुछ तो मैंने पढ़ा है. Can you tell me, guys, what have you studied about it? I will come back to all of this. That's okay. वो तो हम कर लेंगे. आपको क्या क्या पता है? When I say interleukin 10, अभी तो we have no time shortage ना. No 70-second timer of NEET PG on our head. तो चलो, let's give it a good shot. Interleukin 10 के बारे में what do I study? It is anti-inflammatory. That is what we had studied. It is AN10. It is the only anti-inflammatory. It stops inflammation. What do I know about interleukin 4? Interleukin 4, remember the story of Char Chalis? Interleukin 4, which is Char, and CD40, which is Chalis, is the one that changes MD antibodies into GAMD antibodies. What is that process known as? Char Chalis causes the change, that is isotype switching. Okay, then what do I know about interleukin 2? although not very important, but interleukin 2 also helps in natural killer cell stimulation. Nahi yaad, never mind. What do you know about interferons? Because if you've read the answer by now or question by now, you know interferons are of three types: interferon alpha, beta and gamma, and तीनों का जो function है is alpha, beta, gamma. So alpha has what function? It has antiviral properties. If you go back, they might be producing something to do with protein kinase R, some recombinant protein, but आगे पढ़ते हैं. They are trying to do a lot of things in what? In virus infected cells. So they want there should be an inhibition of the viral protein synthesis. Which of these cytokines can decrease viral or have antiviral properties? It is interferon alpha. So haven't you seen this PYQ in NEET PG? Which interferon or which cytokine has antiviral properties? अभी तक life easy था. तो concept वही है, topic वही है, complication है. Complication जितना भी होगा, examiner will have to write this word for you to answer. This examiner cannot hide. He can give you a million tough statements, but buzzword के बिना तो question solve होगा ही नहीं ना. Examiner will have to speak that out. So wait for the examiner to blabber as much as he wants till you reach that one buzzword that you were waiting for. उसे बोलने दो, उसे जितना बोलना है बोलने दो, and have that confidence. The more someone will speak to you, the more secrets he will tell you. So जितना examiner बात करेगा अच्छी बात है, because then he will end up telling you a secret which you had to mark. Now finish the question. Interferon beta क्या करता है? It is used for the treatment of a brain disease, that is multiple sclerosis. And interferon gamma, living in India, you have to know this question. Granuloma formation में help करता है. मतलब TB का question आया, which interferon am I always marking? It is interferon gamma. Is that okay with everyone? So many of you saying, ma'am, please include these questions, but that is what I'm doing. You are just supposed to follow the Telegram quizzes, because every alternate day for Path and Micro, I am giving you such questions where it makes no sense for first 2-3 sentences. And now students, first day students were like, we found it very difficult. Now we are 4th or 5th quiz into it. Now they're very happy कि हाँ आदत हो गई है. Something very complicated will come and we will ignore it, but we will come to that one buzzword and we will answer it. Chalo, solve one more question. It keeps getting lengthier and lengthier. I'm not saying all your 180 questions are going to be like it, but I am just trying to prepare you कि एग्जाम में वन लाइनर्स होंगे, बट वो आपको आते हैं, so I am not wasting time on those. Medium questions होंगे, hoping that also you know, so I am not wasting time on those also. I am just preparing you for the tough part of the exam which you are scared of, because I had a time limit of 25. I didn't want this to be a 4-hour session, right? So 25 questions में I wanted I should give you only the toughest ones, the lengthiest ones, because one liners so you are champs, you will do it anyway. Now this is a question which I made depending on this topic that came recently in both INI as well as FMG. So अब इसमें जो बचा, this is not a question which everyone has read. I have also not taught you, but फिर भी हमें answer तो देना है ना. So let me start. What did you say? All of you started saying D. Why D, guys? Just because, okay, very good, because of an activation of adenylate cyclase. Okay, very good, that's exactly why I gave it to you. तो चलो पढ़ लेते हैं. What did you make as your diagnosis? There is a painless black eschar on the forearm after handling livestock. Whenever this animal handling story comes, ma'am, with this eschar, we are thinking of our favorite Bacillus anthracis. Bacillus anthracis has a toxin which has 3 parts. वो लिखा भी था. Bacillus anthracis has a toxin which has edema factor, they have written, protective factor, they have written, lethal factor, they have written. तो यही था इस बार का FMG question, where they had an animal handler and they said what are the 3 parts of the toxin. Anyone who had read even rapid revision video knew that अच्छा 3 parts of toxin. This was in the option: edema factor, protective factor, lethal factor. यहाँ तक आ चुका है. Now how they can make it toughest possible? They say investigators create a mutant strain lacking protective antigen. They are saying this protective antigen is not there. तो क्या क्या है? The edema factor is there and lethal factor is there, but because of the protective antigen not being there, the mutant organism cannot work. You need to understand 3 चीजें थी. We needed 3 things. Out of them, 1 thing is not there. So this means the others will automatically not be able to work. So they are asking you, what is the function performed by the protective antigen? पर मैम आपने हमें ये पढ़ाया नहीं था. ये तो हम second prof में भी नहीं पढ़ते, but question तो आया. So what should I do? Let me start. Does it cause ADP ribosylation of EF2? No. Who causes ADP ribosylation of EF2? It is caused by diphtheria toxin and pseudomonas toxin. तो ये तो out. Does it do something to do with snare proteins? No, that is Clostridium botulinum. In that, the question should have been canned food, bottled food, floppy baby wala. This is also out. Either I'm left with this, there is a transmembrane pore, which I don't know about, or there is activation of adenylate cyclase, which all of you thought was the answer. Now tell me, when you read in your notes, you are all right that cyclic AMP to बढ़ता है. But who increases cyclic AMP? Go back to, even if you've done rapid revision notes. Over there, it's in your notes, but क्या हमने ध्यान से पढ़ा? Did we pay enough attention to it? Edema factor increases cyclic AMP. Is that the question? Did they ask me that what function is normally served by edema factor? ये था question, ये नहीं था question. So this is not the answer. What am I left with? I am left with the option which makes zero sense to me, and I still don't want you to learn it, because this question was not about कि आपने क्या पढ़ा है. This question was about ruling out the options. कि two options तो every person with baseline knowledge also ruled out. Now I know that it increases cyclic AMP, but that's the edema factor. तभी तो edema होता है, तभी तो that black esture forms. But they've not asked me the function of edema factor. They've asked me the function of some random factor, protective factor. So the option that I'm left with, that it actually makes pores for the entry, which again I don't want you to learn. And if you feel scared after such kind of questions, so that is why I'm making you practice कि अभी करो गलती, do as many mistakes as you want, and then you will not do such errors when it comes to the exam. I hope that kind of got you back on track. कि कई बार आपको बहुत easy है सब, मैम ये तो इतना lengthy, cyclic MP how easy, mark and move, but you didn't read it properly and you don't want to lose such marks in the exam. Okay, let's move on to another very tough question. So 2, 3, as I said, these are nothing to do with PYQs, although the session is about PYQs, but I have tried to make it PYQ ka toughest level possible. There's a 4-month infant with paroxysmal coughing with emesis because of excessive coughing. There is vomiting happening. I think this question becomes easy because this is Bordetella pertussis, whooping cough ka question hai. Lab studies have revealed lymphocytosis, which would happen. They are saying there is a toxin which is going to do some ADP ribosylation of an inhibitory G protein. They are asking what intracellular change is expected. This is your favorite question, which I know, that अच्छा cyclic AMP कब बढ़ता है. Cyclic AMP increases, number one, ma'am, it increases with that rice water stools, that is cholera, which was this time's FMG exam question. Number two, it is increased by anthracis, and now you know which factor of anthrax increases it. It is the edema factor that increases it. Next, we said we will make it as E. coli. E. coli का कौन सा toxin increases cyclic AMP? Labile toxin or stable toxin? We used to study labile people only do hawabazi, they are in the air. So labile toxin. And finally comes the answer over here, that is whooping cough or pertussis. It increases cyclic AMP. देखो अब now the people in a hurry would have just looked at this or looked at the channel adenylate cyclase, same as cyclic AMP, and marked it, but that doesn't decrease cyclic AMP. It increases cyclic AMP. You might right now think how dumb, ये गलती तो कोई नहीं करेगा, but आप करोगे. जब exam में you will have one after the other 70-second timer ticking on your head. Sometimes you will make the random silliest of errors which you otherwise don't make. Hence I say make as many errors right now. Be in the stationary phase. GT score is remaining stagnant. I really don't care at this point of time. What are you learning from that stagnant GT score is what makes more sense, right? Moving on to the next question. Okay, there is a laboratory that combines heat-killed encapsulated pneumococci with live non-encapsulated bacteria. So in simpler words, as I said, English to Hindi or English to any language which you are comfortably understand, there is going to be a pneumococcus with a capsule and a pneumococcus without a capsule, and they have basically combined the two. I have understood this. The resulting bacterial population becomes capsulated and virulent. This means the bacteria without the capsule has now got the capsule. So something has transferred from this bacteria to this bacteria, something has transferred. They've asked you what property and what has that transfer been through. So all of you have answered what? There's a confusion between actually all A, B, C. At least you understand this is nothing to do with division or binary fission, mitosis, ऐसा कुछ नहीं है. It is one of these three. So now remember, whenever I'm saying कि अच्छा something has gone from one bacteria to other, there are three ways on this can happen. This is bacteria number 1, this is bacteria number 2. The first way is that I make a physical contact between the two. दोनों के बीच में you make a bridge, and then one thing from the bridge anything can travel. So this contact वाला thing is known as what? It is known as conjugation, and that is the most common mode of antibiotic resistance overall. If anyone in pharmac or in micro asks you how does antibiotic resistance gene travel from one bacteria to another, you will say through a contact and through a conjugation. However, if they ask you what is the most common mode of transfer in Staph aureus, imagine this is one Staph aureus, this is another Staph aureus. In दोनों के बीच में it is not through contact. In दोनों के बीच में it is through this tadpole shaped bacteriophage, and that process is known as transduction, like a zomatoswiggy. Transduction means bacteriophage will pick up something from here and go and deliver it. Food will be picked up from one bacteria, given to another. So gene will be picked up from one and given to another through this delivery partner. That is known as transduction. That is for Staph aureus. But what is the most common technique for Streptococcus pneumoniae, which was the question over here, and that is transformation, which is the answer. So what is transformation, ma'am? Imagine this is a Streptococcus pneumoniae that I have drawn. If it says I want to get a new capsule, like it wanted to get a new capsule here, or you want to get a new DNA, a new antibiotic resistant, it is very lazy. Neither is it going to make any contact with anyone, nor will it order anything through a delivery partner. It will pick up any naked DNA that is present in the environment. It will say, okay, just take it. Just eat it up. That is what it's going to do, and that is known as transformation. So the rule is, overall, if they would have asked me, answer conjugation. For Staph aureus, if they would have asked me, my answer would have been transduction. But for pneumococcus or Streptococcus pneumoniae that they asked me, my answer is transformation. Is that also okay? Yes, someone saying ma'am पढ़ जाते हैं but भूल जाते हो. So see, there are 4-5 subjects, so even I will read and forget. No one is a super brain. Micro, biochem, pharmac, PSM, ये तो कोई भी पढ़ेगा, even ANAT for that matter. And if you read, you will forget. I mean, you don't read that or revise that for 15 days, you will forget. If I stop teaching for 6 months, I will also forget. I'm also a human being. So that happens to everyone. उसमें आप कुछ बहुत ultra dumb category में नहीं चले गए हो. You are just a human being who's behaving like a human being. हाँ, if you come back to me after 6 months saying that I remember all 100-200 pages of the subject, I will be very worried for your brain. That what trauma led you to retain microbiology for 6 months? What happened in your life like that? So then if you're reading and you're forgetting, you're just a normal human being, and everyone goes through that same cycle. If everyone or anyone could remember everything, then everyone would have got a 200 on 200 or 180 on 180 questions right in the exam. So that doesn't happen even with rank 1. This means as a human being, everyone makes errors and everyone forgets. जब भूल जाओ, you have two options. Either you sit and sulk over it, cry over it, crib over it, and then just give up on life. Second is you take it as a part of the game, and then you say that this is not how this can be. I have to look into it. क्या भूले थे? क्यों भूले थे? Don't ask yourself. वो तो भूलोगे. I'm a human being. I will forget. क्या भूले थे? Okay, this is what I forgot. Okay, I will read it once again. I will and learn it like that only कि अभी पढ़ा and laugh over it कि अरे 10 दिन ही याद रहेगा, 5 दिन ही याद रहेगा. After that I will come back to it. Next GT में फिर से गलती होगी, again I will read it. If you study it in a light-hearted way, you will probably remember it for 2 additional days. If you study it with that pressure कि मेरे ही brain में problem है, I am the dumb one, I am the one who's forgetting, but my friend is remembering, these sort of things actually create a lot of negativity and don't get you anywhere. Moving on to the next question that we have. I've hidden a part of this question because I first want to see, can you answer it without looking at the full question? Then I'll show you the complete question which I've hidden. There is a patient with prolonged hospitalization, develops bacteremia, probably going into sepsis, and that is mentioned with enterococcus. They are saying the organism is, because we usually start with penicillin. Penicillin is resistant, so धीरे धीरे we go to vancomycin, but this patient is resistant to vancomycin also. This bacteria is resistant. Which process is directly inhibited by vancomycin under normal circumstances? That is what? Cell wall cross linking. But हाँ, जो part of the question which I hid from you, I will now show you, because that makes your answer a lot easier. Genetic analysis shows replacement of D-ALA with D-ALA-D-lactate. Now that makes sense. Just imagine ये कोई bacteria है, and I'm going into a little bit of pharmac. This is the bacteria and this is the cell wall of the bacteria. This is a bacteria, this is the cell wall of the bacteria. The normal cell wall has D-ALA. That is how we will write it. And this is where the vancomycin is going to come and act. Vancomycin कहाँ act करता है? It acts on D-ALA. So this is like a lock and key phenomena. Okay, this is the key will come and act on which lock? That is D-ALA, and then the bacteria will be killed. तो मैंने lock change कर दिया. Bacteria says ठीक है, let's change the lock. Let's make it either D-ALA, D-lactate, or they can make it D-ALA, D-serine. Now tell me, will vancomycin be able to come and act on the bacteria? No. And that is why the bacteria becomes, यहाँ पर कौन सा? Vancomycin resistant enterococcus बन गया. So basically vancomycin is working on the cell wall on D-ALA, and that's my answer. Some of you said, ma'am, what if 180 questions ऐसे आ गए? So then I should have also done that. I should have given you 180 questions, जिसमें से I should have wasted your time in making you solve 160 questions which were already solved by you in the Q bank, and फिर I would have given you 20 questions, so you would have felt very happy. I decided to just eliminate those 160 questions for today. I said ठीक है, इनको 160 questions तो ये रोज अपना हर प्लेटफॉर्म के GT में, सब्जेक्ट वाइज टेस्ट में, मिनी टेस्ट, मैक्स टेस्ट सब में दे ही रहे हैं, तो 160 questions मैंने आपको दिखाए नहीं. I am showing you the 20-25 tough questions and saying it again and again. Either you can give me the the advantage that मैम आप हमें टफ के लिए प्रिपेयर कर रहे हो क्योंकि ईजी हम ऑलरेडी ऑन अ डेली बेसिस प्रिपेयर कर रहे हैं, और यू कैन अगेन सिट एंड क्राई ओवर इट कि अगर ऐसे 180 क्वेश्चंस आ गए तो फिर तो हमारा कुछ नहीं होगा. देन द पर्पस ऑफ दिस सेशन इज एक्चुअली लॉस्ट, बिकॉज देन आई शुड हैव ऑल्सो वेस्टेड योर टाइम, मेड यू सिट हियर फॉर 6 hours, मेड यू सॉल्व 180 क्वेश्चंस, जिसमें से 160 क्वेश्चंस आपका टाइम वेस्ट होता. 20 questions is where you would have needed my guidance. I have eliminated it. I have only given you 20 questions where you truly need my guidance. 160 तो आप मैनेज वैसे भी खुद कर ही लोगे, जो easy वाले हैं, one liners हैं, वो हम LRR में भी पढ़ेंगे. So the purpose of this session is not to scare you. The purpose of this session is to make you so used to seeing such questions that then you feel कि अरे ये तो normal सा है. Let's move on to the next one. I believe this is also something you'll be able to solve easily. There is a 19-year-old college student with low-grade fever, dry cough and headache. Now they say diffuse interstitial infiltrates on a chest radiograph. Cold agglutinin testing reveals antibodies that react with erythrocytes. Cold है तो at low temperature. I think when I say cold agglutinin test, cat sat on a mat. किसके लिए cold agglutinin test होता है? Mycoplasma. And they are saying that mycoplasma dry cough, because atypical pneumonia, walking pneumonia it causes. Then they say this organism differs from a usual bacteria, typical bacteria, because it lacks what? We all know. ये हो गया ना आपका easy. इसमें तो नहीं डर लगा. This is a case of mycoplasma pneumoniae which does not or lacks a cell wall. And then one last time, let's come to your type of questions. Cat sat on a mat, which means cold agglutinin test, standard agglutinin test and microscopic agglutinin test. This came in the recent FMG exam that happened this month. So now cold agglutinin test is done for mycoplasma, which is the answer over here. Bata do, standard agglutination test is done for brucellosis and microscopic agglutination test is done for leptospira. Leptospira to is like their again trending topic in the last 2 months, in the last 2 years, but now in the last 1 month, ever since the Mumbai monsoons have risen the cases of leptospirosis, तो examiner की memory में भी तो refresh हो गया ना. So this means there could be a good question on leptospirosis, and what we have studied till now is leptospira. Remember कि rat urine होगा, rat urine will contaminate the rainy water and rainy water will be used by the rice field workers. तो you think in the exam सिर्फ farmer की history होगी, rice field worker की history होगी, but I am saying rat urine is contaminating rainy water and anyone who gets exposed to that rainy water. So recently in Mumbai a lot of cases have come up because flooding, rainy water. अब उस rainy water में अगर rat urine होगा and people start walking in that rainy water in those puddles, they will also get exposed to leptospirosis. And can you tell me, I'll draw one small little thing, what is that buzzword in leptospirosis? Eyes में क्या? Conjunctival redness, conjunctival injection. That is exactly how patients have been presenting. That is leptospirosis. Okay. Now coming to another question, which again I picked up all which are not usual questions. 56-year-old man with poorly controlled diabetes. Usually all my questions in LRRs and RRR sessions have diarrhea. So I said, okay, let's move away from diarrhea. Let's pick up a different disease. That's सबको diabetes हो रहा है. And that is how I expect the exam also to have a lot of diabetes questions. Fever है, there are night sweats with weight loss and hemoptysis. In our country, thinking of all these, TB नहीं आया आपके mind में, so there's a problem. Fever, weight loss, night sweats, cough, sputum, इसके साथ first thing striking in your mind has to be TB, but let's see. Lung biopsy shows granulomas. Okay, could be TB. Acid fast bacilli, numerous, again going in favor of TB. Molecular analysis shows the organism produces a lipid to prevent phagosome maturation, because the first line that I teach you in TB, whenever any bacteria comes in our body, who goes and eats it, which is that hungry foodie cell? It is a macrophage. So why is it that the macrophage did not eat TB and then we ended up with TB so much in our country? Because macrophage क्या कराएगा? Phagocytosis. Phagocytosis कैसे होता है? Phagolysosome formation. But ma'am, TB says I will not let the macrophage work, I will not let phagolysosome formation occur, and no one can eat me. That is why we are so scared of TB. So how does TB stop the process of phagocytosis? Yes, by the process of lipoarabinomannan. LAM produce करता है. Every TB bacteria has lipoarabinomannan, because of which it does not let macrophage to eat it and अपना protection वो खुद लेके आए. So when it comes to TB, there are 2-3 set questions that they are going to ask you. Number one, they will, अगर ये होता कि अच्छा it is acid fast, can you tell me which is the reason or what is the reason for acid fastness? Which acid is responsible? ये आपका NEET PG question है, your easy question. Mycolic acid. Acid fastness is because of mycolic acid. If they ask you which is the reason for which phagocytosis cannot occur, it is lipoarabinomannan. If they ask you what is the virulence factor, सभी virulence है मैम, but single best virulence factor if they will ask me, that is going to be cod factor. So all these very second profish kind of questions ना, कि बहुत core theory में जाके question अगर TB का पूछा, because every word of TB is important, let's admit it. तो ये तीन आपके very core ratification questions that they can ask you about TB. बाकी you all know those PYQs. I'm not, as I said, I'm not asking you LJ media पे rough buff tough colonies, वो तो हर कोई पढ़ के जाएगा, you have to study that. So that is something we leave for the LRR revision, कि हाँ वो तो पढ़ना ही है. As I said, there will be a lot of questions on mechanisms. So I decided, let's waste your time. Let's not ask you one mechanism. Let's ask you 3 mechanisms in one question. Question same है, topic भी same है, मुझे आपका time waste करना है. Exactly what the examiner is doing now. So there is one toxin causing watery diarrhea by increasing cyclic AMP. I think I've understood ये rice water stools होगा. This must be Vibrio. Just an assumption. Another toxin causes paralysis by preventing acetylcholine release. Paralysis, acetylcholine causes contraction. It says it is not having release of acetylcholine, no contraction. This means the muscles are loose. That could be a case of Clostridium botulinum. Further, a third toxin causes necrosis by stopping protein synthesis and pharyngeal necrosis, pseudomembrane. Maybe it is a case of diphtheria, but itna nahi sochna tha. Everything is written over here. You just have to match. Instead of giving you match the following, they give you 4 options. This is your kind of question. ना cholera कैसे कराता है rice water stools? By increasing cyclic AMP. If cyclic AMP is not written, what will be written? By increasing adenylate cyclase, which was written in this FMG exam. It means the same. इतना physiology आता है. What does botulinum? How does that decrease acetylcholine release as written over here? By damaging the snare proteins. And diphtheria कैसे करता है? ADP ribosylation of EF2. So the first option itself is fitting well. बाकी सब तो they have done all mix and match, which I don't want to get into. So whenever you get this kind of a question, and I saw so many options, and I know my mind, when I start reading every option, मुझे confusion हो जाएगा. I will start doubting myself कि मुझे क्या याद है क्या नहीं. So when I see these multiple things happening in a question, तब क्या approach है? तब अपना आंसर बनाओ. थिंक ऑफ योर आंसर कि अच्छा सो मेनी मैकेनिज्म्स आर रिटन, इन तीनों का पहले मैकेनिज्म अपने माइंड में सोच लेते हैं. कॉलेरा क्या करता था, नोट्स में क्या पढ़ा था. बॉट्यूलिनम क्या करता था, डिप्थीरिया क्या करता था. आई थॉट ऑफ माई आंसर एंड देन आई फाउंड माई आंसर इन द ऑप्शंस ओवर हियर. सो व्हेन द स्टोरी गेट्स वेरी कॉम्प्लिकेटेड ना, तो एग्जामिनर विल ट्राई कि आपको इतने सारे ऑप्शंस दे दैट यू फील टू ओवरवेल्म्ड, इंटिमिडेटेड. तो आपको उससे डिटैच करना है. यू हैव टू टेक दैट 10 seconds of solace, of peace, think of your answer, come back to the question, you will find a match for yourself. Moving on to the next one, let's go on to योर काइंड ऑफ क्वेश्चंस. हमें मैम इजी वाले भी तो 5-6 क्वेश्चंस करा दो, सो दैट वी डोंट गो बैक फ्रॉम दिस सेशन थिंकिंग दैट मैम ने आज सिर्फ टफ क्वेश्चंस कराए. 42-year-old HIV पॉजिटिव पेशेंट विथ क्रॉनिक हेडेक, इंडिया इंक प्रेपरेशन ऑफ CSF, पढ़ना ही नहीं आगे. इंडिया इंक आते, बाय द वे द INI-CET had nigrosin written. Is there something common between India ink and nigrosin? इस बार का May INI exam had this. What kind of a stain is it? It's a negative stain. What have you thought of cryptococcal meningitis? And anyway, HIV positive cryptococcal meningitis, they've asked you what is the virulence factor. It is a capsule. All capsules are made up of polysaccharide. Repeat. Now, this is not what I wanted you to revise. NEET PG PYQ mein, this is the theory which I want you to revise. All capsules are made up of polysaccharides. Very good. Like this capsule is also made up of polysaccharide. Answer is done. Except for your favorite Bacillus anthracis, which was asked in the INI exam, that is made up of polypeptide. They write the name of any peptide, you will not fall for the trap. It means the same. Polypeptide likhe, polyglutamate likhe. Okay, what next? Level 2 question aa chuka hai na. All capsules are made up of polysaccharide except anthrax is okay. What is the test for polysaccharide capsules? What is the test for polypeptide capsule? General micro ka second page is where all of this is written. For all polysaccharide capsules like this one over here, we will do the Quelang reaction. But for polypeptide, जो main है हमारा anthrax वाला bioterrorism वाला agent, for that we do the Macfadyen reaction. क्या होता है Macfadyen reaction? I use a color in it. I want to stain the capsule. Capsule को stain करने के लिए which color I'm using? Polychrome methylene blue. So where you're using methylene blue, that is known as Macfadyen reaction. Everything have you studied? Anthrax का capsule का story done. Anthrax का toxin का story also done. Edema factor, protective factor, lethal factor. So as I said, this came in INI, and your EPL tha, that came in FMG. So something will come in your NEET PG also. Let's move on to the next question. Another which is your favorite. Patient develops severe watery diarrhea after having contaminated seafood. Now usually when they say seafood, they mostly tend to write prawns. And when they write prawns, the bacteria that comes to my mind is P for prawns and P for Vibrio parahemolyticus. Clinically मुझे ऐसा लगा. But when I read it further, they said it's a comma-shaped organism with darting motility and watery diarrhea. Then I believe, no, it is not Vibrio parahemolyticus. This is a case of Vibrio cholera. And Vibrio cholera क्या करता है? You already know, it increases cyclic AMP, comma shape है, shooting star motility है. तो cyclic AMP adenylate cyclase बढ़ाता है, then the life becomes easier. और क्या पूछ सकते हैं over here कि जो cholera toxin है उसका दो parts. Part A तो action करता है, it increases cyclic AMP, watery diarrhea, okay. What does part B do? Part B of that toxin binds to which part of your intestine? PYQ, NEET PG, GM1 ganglioside. So they might give you an intestinal cell because you never know these days, video, image, anything can be there. So this is intestine कैसे पहचाना? Ma'am, they were villi, so I understood they gave me an intestinal cell. Over here, there was a labeling of GM1 ganglioside. So कोई तो bacteria था that was coming and binding to GM1 ganglioside. And after that, inside the cell, they had said there is an increase in cyclic AMP. If this kind of an image/video question comes where GM1 and cyclic AMP are there, they'll ask you which is the toxin for which the mechanism has been shown over here, or something to do with Vibrio cholera. Maybe its motility will be asked. Maybe its shape will be asked, and I think you know how to solve it. Very good. Let's move on to the next question over here. Another expected one. ये तो आपका PYQs. These last two three questions are all PYQs. Prosthetic valve endocarditis has repeated blood cultures positive for coagulase negative staph. We are talking about which category. Is this Staph aureus? No. Staph aureus is coagulase positive. यहाँ बात चल रही है coagulase negative की. Coagulase negative staph दो ही है. One is Staph epidermidis, one is Staph saprophyticus. This can't be saprophyticus because saprophyticus causes UTI, and epidermidis causes prosthetic valve endocarditis, which is the question over here. तो हमारा आंसर है epidermidis. पूछा क्या? Which property is going to explain the persistence? Because there are repeated cultures positive. Why is it persisting for so long? Because Staph epidermidis is known to cause a biofilm. अब आगे क्या question आएगा? What is a biofilm made up of? It is made up of polysaccharide. Remember, all capsules were also made up of polysaccharide except anthrax, but all other capsules are polysaccharide. So all biofilms are also polysaccharide. And what is the property that biofilm, if this is a bacteria and a biofilm is formed around it, means it's like a protective cage. Now no antibiotic will be able to kill that bacteria. It makes this bacteria antibiotic resistance, which everyone knew. Very good. Okay, I think, are you ready for the next 5 questions? ये आपके type के questions हैं, feel good factor questions. These are the ones that you have studied maximally in your PYQ bank. So here we go. A child presents with pseudomembranous pharyngitis. Membrane in the pharynx, क्या सोचा? Diphtheria सोचा. Albert Staining लिख दिया, मैम पक्का diphtheria सोचा. They've asked you the mechanism of action. See, your type of question, अब अच्छा feel हो रहा है. Now you're not feeling कि oh this is so tough and I'm going to die in the exam and all those things that you were writing. तो अब अच्छा, but let me just tell you that you'll have a mix of both. अगर ऐसा question होगा तो फिर वो lengthy वाला भी होगा. That is how it's going to be. So a quick revision. What are all the bacterias that are going to decrease the protein synthesis? That is how we will learn it. Protein synthesis, decreasing protein synthesis के लिए we have diphtheria toxin, pseudomonas toxin, Shiga toxin and Shiga like toxin. First tell me, how do diphtheria and pseudomonas decrease the protein synthesis, which is the answer over here, by ADP ribosylation of EF2. How do Shiga and Shiga like toxins decrease protein synthesis? By decreasing 60S ribosome. That is how protein goes down. Now my question is that how does E. coli decrease protein synthesis? Out of which mechanism? इस mechanism से या इस mechanism से? How does E. coli? Ma'am, where is E. coli over here? Diphtheria, Pseudomonas, Shiga and Shiga like था, but E. coli कहाँ था is my question. Diphtheria, you understand, is made by diphtheria. Pseudomonas toxin is made by Pseudomonas. Shiga toxin obviously is made by Shigella. So now my question is, who makes Shiga like toxin? That is made by E. coli. तो आपने जैसा पढ़ा, examiner is not obliged कि वो same language में लिखेगा. You read Shiga like toxin, but examiner is wanting to ask you, how does the mechanism of E. coli happen with decreasing protein synthesis? What is the mechanism? So it is Shiga like toxin made by E. coli, means by decreasing 60S ribosomes. Let's move on to one of your more favorite questions. There is a microbiologist performing ZN stain on sputum. ZN stain सुनते ही which clock alarm rings in your mind? हमारी country में TB, acid fast bacillus मिला. Yes, their question is acid fastness is because of which property of TB? We've just answered it. It is mycolic acid. और कौन सा TB का PYQ आता है? कौन सा culture media? LJ media. What kind of colonies are grown in TB? It is the rough, buff, tough colonies. How much time does it take for these colonies to grow? It takes 6 to 8 weeks, and that is why this is a very long time that the report takes to come. So LJ media is good and is mentioned in all TV programs and everywhere, but what we are preferring to do nowadays for the diagnosis of TB is gene expert. कौन से type का test होता है? It is CBNAT, cartridge based nucleic acid amplification test, मतलब genetic testing, because here I am going to get the report in 2 hours. Getting the report in 2 hours versus 2 months, I can see the difference, and now I know why Gene Expert is better than LJ Media. But inka favorite LJ Media, colonies, rough, buff, tough. I think all PYQ done. Okay, another question on PYQ. A patient presents with severe diarrhea after prolonged clindamycin therapy. Long term antibiotic therapy के बाद अगर patient को diarrhea हो रहा है, so now you know you're talking about Clostridium difficile, but that's not what they asked you. They asked you Clostridium difficile का कौन सा toxin होता है, and that is what your theory. This is again a PYQ. Clostridium difficile कैसा दिखता है? ऐसा दिखता है. Ma'am, it causes a disease called what? Pseudomembranous enterocolitis. Can you see on endoscopy this pseudomembrane, yellowish pseudomembrane? Yes. And what appearance will you see? जैसे volcano burst होता है, lava erupts, microscopically we get get to see the volcano-like eruption, and that is what you are supposed to know. Very good. तो ये सब Clostridium difficile, pseudomembranous enterocolitis, volcano-like eruption भूलोगे क्या? What are the toxins of pseudomembranous enterocolitis or Clostridium difficile? Toxin A and toxin B. Tell me one more PYQ. What is the culture media? Clostridium difficile के लिए we have CCFA and CCYA. जैसा उसका नाम है. So many selective media I'm telling you, only the ones that you forget. Like for Pseudomonas I told you it was the Cetrimide agar. For anthrax I told you it was the Plet agar. In this only, in this session only we've done this. And for difficile I'm telling you it is CCFA and CCYA. Perfect. Moving on to the next question that we have. Again, medicine micro का integration. A patient with infective endocarditis, we know as per the Duke's criteria, infective endocarditis के लिए the first thing tells me that blood culture कराना है. कराया. Colonies show alpha hemolysis. As soon as they say alpha hemolysis, and what all can you read? Staph तो नहीं आएगा. Staph का classification is not alpha beta gamma, तो remove करो. ये streptococcus enterococcus वाली family is alpha beta gamma. तो what all comes in alpha? VP, विरिडेंस एंड निमोनिया. V and P. अब इनमें से इन्फेक्टिव एंडोकार्डाइटिस कौन कराता है? वैसे भी विरिडेंस ही कराता है. सो वन थिंग इज सर्टन कि अल्फा हिमोलिसिस में दो आते हैं. अगर निमोनिया मेनिंजाइटिस का हिस्ट्री होता आई वुड हैव थॉट ऑफ निमोनिया, दैट वुड हैव बीन ऑप्शन ए. बट अगर valve endocarditis है या फिर there is infective endocarditis, I will think of viridins. Further, if I want to differentiate, because both of them are alpha hemolytic, one way of differentiating is their shape. Viridins is going to be present in chains, and pneumonia I just now told you is like diplo, दो का lens shaped. वो भी नहीं लिखा, they had written something else. Remember, viridins says everything को no, no, no. If you ask viridins that will you show bile solubility, viridins will say no. Will you show inulin fermentation? Viridins will say no. Will you show optogen sensitivity? Viridins will say no. So क्या लिखा है यहाँ पे? Optogen sensitivity नहीं था, optogen resistance है. That further makes it a case of viridins and the answer. On the other hand, उसका opposite pneumonia says I will say yes to everything. Bile solubility, inulin fermentation, optogen sensitivity, सबको yes, yes, yes. सबको yes बोलो जैसे life में करना चाहिए. Say yes and live a peaceful life. Don't contradict anyone. किसी से लड़ाई नहीं करना. Say yes to everyone. Chill life करो. Chill life मतलब कैरम खेलो, खुश रहो. Don't take tension. So what kind of colonies does Streptococcus pneumoniae show you? It's a very chilled out pneumonia, is very chilled out. हर चीज़ को yes, yes, yes. So bio tests are yes. Chill करता है, कैरम खेलता है, तो कैरम coin और Drotsman colonies. So if that would have been the situation, answer pneumonia. But यहाँ पर तो क्या बोला? It is optogen resistant, तो infective endocarditis के साथ viridins. Perfect. Coming on to last two questions and you're done for the day. A patient presents with recurrent gastric ulcers. Gastric ulcers सोचते ही with the bacilli, there is nothing other than only one bacteria in a gastric situation that you can think of, which is going to be H. pylori. We know H. pylori में हमेशा वो medicine में rapid urea test, urea breath test, urea test करते हैं. That is why they have written there is production of abundant urease, but that's not what they are asking me. They are saying which virulence factor is very important. तो क्या आप I have maybe not taught you in detail, but आप इसमें से क्या select कर सकते हो? All very good. One virulence factor is urease, but वो तो examiner ने लिख दिया. It's not there in the options. The other one is going to be perfect. It is going to be flagella, because all the bacters, कौन से bacter मुझे पता है? एक है H. pylori. H. pylori मतलब Helicobacter pylori. एक और bacter है, the one that grows in the June का temperature 42 degrees, that is known as Campylobacter. So whether they write Helicobacter or they write Campylobacter, you should know that both of these are motile and they are going to be flagellated. इनके अंदर flagella होता है, and Helicobacter of course goes into the stomach. तो stomach में क्या क्या कराता है? Simple things मैम, जैसे इस patient को gastritis हुआ होगा, after some time the patient ended up having peptic ulcer disease, तो ये तो manage हो जाएगा, gastritis ulcer is fine. But what I'm scared about are the two cancers. It can cause adenocarcinoma of the stomach stomach and it can cause which lymphoma? Maltoma of the stomach. ये दोनों cancers is why I'm so scared of H. pylori. And next PYQ. How does it cause cancers? What are the two superpowers that H. pylori has? It has CAG-A and VAC-A. These are the two superpowers by which H. pylori causes cancers. एक last question बता दो. What is the special stain? It is the Warthin starry silver stain, which you have studied so many times. And this brings me to the last question that I had planned for you. Again, a PYQ. There's a patient with fever, platelet count has gone down. अभी तक क्या क्या सोच सकते हो? In this setting with monsoon there, post monsoon, fever and platelet count going down, मुझे starting में लगा था this is something to do with dengue fever. See, just because the options you have read and you have the bias, that is a separate thing. But patient wise सोचो fever है, platelet count going down, I will think of dengue fever. Dengue fever का अगर question होता है, नहीं अगर होता तो within the first 5 days of the disease, what testing would you do? And after 5 days of symptom, what testing would you do? Within the first 5 days, I will do antigen testing, that is NS1 antigen testing. And after 5 days, I will do antibody testing, that is IgM antibody using ELISA. If it would have been a dengue related question, which it is not, because I realized that there is an eschar over the trunk. And wheel Felix test has been given as positive with OXK antigen. This is a case of scrub typhus. So my question is कि scrub typhus का पहले तो, and I won't write it like this, I will write it as scrub typhus because we had studied that the only antigen test coming positive in scrub typhus is OXK. तो scrub typhus कराता कौन है? Who causes it? It is caused by Orientia susugamushi. But what is this? आपका last PYQ and done for today's class. What is wheel Felix test? Wheel Felix test is a heterophile agglutination test. Question यहाँ पर आता है when it comes to NEET PG. And if today they want to give you conceptual questions, they will ask you what is heterophile agglutination test. So there is in its name hetero matlab different. So now tell me, this is your patient, you take a blood sample from this patient. Why? Which antibodies are you trying to find out in his or her blood? Ma'am, I'm trying to find out the antibodies of Rickettsia family. पूरा Rickettsia family है. I want to find out the antibodies that if he's infected, he will have antibodies of Rickettsia, which is fine. So rule is that if you're taking antibodies of Rickettsia, then you should have taken antigens also of Rickettsia, but I didn't do that. In my lab, I used antigens of Proteus. Can you see the difference? Antibody किसी और का, antigen किसी और का. Have I done a different combo happening here? Hence, I call it heterophile agglutination test. So which antigens do I use? Antigens of Proteus, that is OX2, OX19 and OXK. The only disease which is going to show me positivity with OXK is going to be scrub typhus, and that is caused by Orientia susugamushi. Does that present with an eschar? Yes, because my PSM question to you will be eschar matlab some keeda machhar must have come and bitten somewhere, right? So which is that keeda machhar? It is the mite. Is it the adult mite which comes and bites us, or it is the baby of the mite that we are more scared of? It is actually the mite larva. And what are mite larvas known as? They are known as shiggers. That is why the other name of scrub typhus happens to be shiggerosis. Adult mite is not coming and biting us. Mite ka baby is coming and biting us. The larva is coming and biting us, which is the shiggers. So if instead of scrub typhus they write shiggerosis, it means the same. And that of course brings us to the end of today's class. I think everything else I had told you. A similar 25 to I'll now, because today was like what warm up. आज तो suddenly you got too intimidated कि अरे ये तो बहुत tough है मैम. But now I think you are immune. It's like first innate immunity था, ये आपका primary immune response था. Now you've got antibodies. Now in the next class when I meet you on Monday, which is July 20th for the patho session, can we do 30 plus questions then? थोड़ा और integrate कर लेते हैं. We'll keep the same timing of 1 hour 15 minutes. We won't exceed the time, but we'll become so immune that we'll solve questions faster. And we'll try that we keep a timer also then. So today I didn't put in the pressure of कि अच्छा 60-70 seconds में भी solve करो, lengthy question भी करो, used to भी हो जाओ. I didn't want to put you through all of that. But when I meet you on Monday, now you know how this is gonna go. PYQ तो करना है, but new pattern भी करना है. So now I'll put that timer on you. I am not going for 70-second timer. I will make you practice in 60-second timer. कि 70 तो आप comfortably कर ही लोगे. I will test you to the limit is what my point is. And anyone who says later on, ma'am इस session के बाद डर लग रहा है, this means you've lost the entire point of this session. All 180 questions are not going to be like this. Did you see towards the end I gave you very easy questions, छोटा questions, 30-second questions, वो भी होगा. लेंदी क्वेश्चंस वो भी होंगे, बट नाउ इफ यू आर यूज्ड टू बोथ, यू आर नॉट गोना सिट इन द एग्जाम एंड काउंट कितना लेंदी कितना शॉर्ट. इट्स लाइक क्वेश्चन आया, मुझे सॉल्व करना है 70 सेकंड्स में, जल्दी हो गया एक्सेलेंट, वरना 70 सेकंड्स मेरे पास है. दैट्स द मोटिव. सो यू डोंट हैव टू क्राई ओवर टफ या ईजी, यू हैव टू क्राई ओवर कि मेरी आज की पढ़ाई का टारगेट पूरा हुआ या नहीं. दैट इज समथिंग यू शुड बी क्राइंग ओवर कि दैट हैज़ टू हैपन. क्वेश्चन ईजी आया टफ आया, आई एम नॉट गोना फोकस ऑन दैट. Okay, thank you so much. Yes, and this session was also to tell you that there is so much of random, unnecessary, useless buzz. I see that somehow, like सोच लो, थोड़ा common sense लगाओ, just snap away from all the social media buzz that is happening. 180 questions में से कितने video based आ जाएंगे? On the worst day also, 20, okay, let's say 30 questions आ जाएंगे. 150 questions तो फिर भी theory आएगा ना. On a very bad day also 150 questions will be theory. Why is it that on every Instagram channel only what everyone is talking about is video based questions? That is not what I'm understanding, unless someone has told you that 180 out of 180 questions will be video based. So this is something that you need to think like an adult with a very sane mind कि ऐसा नहीं होगा कि 180 out of 180 questions are video based, so now I leave everything in my notes and सिर्फ videos ही देख रहे हो, सिर्फ वीडियो बेस्ड क्वेश्चन सॉल्व कर रहे हो, ओनली GIFs यू आर लुकिंग एट. एंड सम पीपल हैव मेड रैंडम वीडियोज आउट ऑफ इमेजेस, मतलब इमेज को जूम इन करके वीडियो बन रहा है एंड दे आर सेइंग वीडियो बेस्ड क्वेश्चन. आई मीन आ जाए तो वेरी गुड, इट कैन हैपन, बट शुड दैट बॉदर यू कि अगर मैंने एक सेम, इमेजिन आई गिव यू अ केस ऑफ एजोपार्डी इफेक्ट इन स्मॉल सेल लंग कैंसर, आई गिव यू अ फोटो ऑफ इट, और इफ आई जूम इन टू इट इन टू अ 5 सेकेंड GIF, अब एजोपार्डी तो एजोपार्डी ही रहेगा. इट्स द सेम स्मॉल सेल कैंसर. मैम, यू गिव इट टू अस in writing, you give it to us as a JPG image, or you give it to us as a GIF. The format, it does not matter. The point is कि आपको एजोपार्डी इफेक्ट आना चाहिए. That is seen in small cell cancer. Do you know the paraneoplastic syndrome of small cell cancer? That matters. I just want to be very clear with these sessions that you are taking a lot of tension for things which are not to be taken. And that also stems from fact that because it's so open-ended and they've only given you the number of questions, not given you a clarity on the format, that is why you are believing anything and everything that everyone around you is saying. But thoda sa abhi you have to think with your own intellect. You are an intelligent person. You have cracked NEET UG, you've done MBBS, you have probably given one attempt before, if maybe you have. You are a very intelligent person that you have reached up till here in life. So not every opinion in the market has to affect you the way you guys are taking it right now. तो हर किसी की बात नहीं सुननी भी है तो ठीक है, बट करो what you think is right, because maybe you are intelligent and that is why you are sitting here today. If you wouldn't have been intelligent, you wouldn't have filled the form for NEET PG, यहाँ तक पहुँच ही ना पाते. तो जैसे भी आए हो, with whatever धक्का you have come here, the point is that you have come here and you have that in you, and hence you are sitting over here, because a lot of others and millions are not sitting over here. So have that faith on your intellect also. Don't listen to random stuff happening on the internet, okay? लास्ट ईयर PYQs नहीं, 5 years तो करो एंड सॉल्व ऑल. नीट के, FMG के, INI के, यू हैव टू सॉल्व ऑल. ट्राई कीप अ टारगेट ऑफ 5 years एटलीस्ट. नीट का तो 5 year करो ही करो. FMG एंड INI, देर आर 2 exams you know that happen every year, so 5 then would mean 10 papers, which can get a little too much. So then you can keep a target of 3 years. कि FMG का 3 years मतलब 6 papers, INI का 3 years means again 6 papers. So maybe for these two you can go for 3 years, but for NEET तो there's without a doubt you have to do 5 years, at least 5 years. But again, as I said, PYQ का copy paste का expectation मत लेके जाओ. All of you have this habit that मैम मैंने PYQ करे तो पता नहीं I have signed a contract with the examiner and he is obliged कि उसे PYQ देने पड़ेंगे. That is again not how it's going to work. No one is obliged to give you what you have studied. You have studied, that is your preparation. Examiner is making a paper, that is his preparation. हमें अपनी प्रेपरेशन उसके प्रेपरेशन से मर्ज करनी है. एग्जामिनर हमारे साथ मर्ज नहीं होने वाला. ही इज़ नॉट टेकिंग दैट फर्स्ट स्टेप फॉरवर्ड. आई हैव टू टेक दैट फर्स्ट स्टेप फॉरवर्ड. आई हैव टू प्रिपेयर. आई हैव टू गो विद माई प्रेपरेशन, and in that preparation I have to go and apply that in whatever difficulty level the examiner will set. So the point is that whenever you are in a fight with someone, तो you know, it's just imagine you're in a fight with someone. अब आप उसी से expect कर रहे हो that he will let you win. Isn't that sounding really dumb? this is exactly the situation you're in. You're in a fight with the examiner, if I can say so. तो अब उससे मत expect करो that he will come your way and make you win. No, he is going to set a benchmark and a standard, making sure that you do not win. But you have to put in every effort to win. So that is the state of war that you guys are in. Okay. Thank you so much for all the patience, for amazing answers, for keeping up with such random information about biotechnology research units I gave you, which did not make sense, but definitely made a lot of sense and got you used to it. I'll meet you again on Monday, July 20th. That session will be at 6 o'clock, but that means that pathology PYQs on the app will be there 3 days prior open for you to attempt. You should ideally be attempting those path PYQs. Also, then I will get to know on the percentage basis which PYQs you guys are getting wrong, and then that is how I pick it out that max errors kahan par ho rahe hain, how can we improve those. Even if you don't get time, you're following your own schedule, no worries, at least join for this YouTube session because you will not be at loss, you will learn something and go. Thank you so much, study well guys, and see you soon. Thank you.